Hi, thanks for joining me today. My name's Matt Murphy. I'm an audiologist here in the Boise Valley and owner of House of Hearing Audiology Clinic. So the question that everyone asks me is, how do I know when it's time to get a hearing test? Then they ask me, is my hearing loss serious enough for hearing aids? Well, if you've been thinking about it at all, or friends and family are telling you to go get your hearing checked, it's probably time. I've learned that most people know they have hearing loss years before they do anything about it. My grandfather was my first experience with hearing loss. This was way before my audiology training. We all knew he had trouble hearing, but it wasn't until my education that I really realized what was happening. As a kid, I noticed that anytime we had a family gathering, he would finish his meal, excuse himself, go into the living room and open his handyman magazine. He wouldn't engage with anyone. Now, after my 20 years in private practice, it still makes me sad. I know that if he had gotten help earlier, things would have been different. He would have enjoyed his friends and his family. He would have laughed at the punchline instead of laughing when everyone else laughed. Now I know he didn't get any of it. I still feel guilty because many times I would choose not to engage with him. It was just too difficult for both of us, so why even make the effort? I get it. If you're like most of our patients, you're getting ads in the mail every day or on TV or the internet like buy one, get one, 2 for 1, free this and free that. Sometimes the hearing aids they are advertising are not the ones you end up with and they sell you a different aid. I call that bait and switch. Have you heard the saying, if it sounds too good to be true, it probably is? Now I know it can be hard to know who to trust, and sometimes it feels like everyone's trying to confuse you on purpose. We all want to make the right decision, and that's why I've made this video. If you're like most of our patients, you've put the idea off for a while now, oftentimes for years. We say it's a 5 to 7 year thought process that typically ends in a 24-hour decision. Hearing loss is an extremely important medical decision. If you went to your doctor and was told you needed a new heart valve, I'm guessing you'd want the best one you could get, right? We want to help you make the right decision. Maybe you feel like you can hear just fine, but misunderstand sometimes. Or you feel like people mumble. If only they would talk clearer. It must be the other person, right? It's their problem. Hearing loss is not about turning up the volume. It's all about the clarity. Do you have trouble understanding conversations? Do you find yourself turning up the TV louder? Do you have trouble understanding in noisy restaurants? Do you have ringing in your ears? Well, if you said yes to any of these questions, it's time for a hearing check. Maybe your partner's been nagging you, or maybe it's your kids. In my experience, most of the time, the people around you knew you were struggling even before you did. It doesn't really matter. When people finally do come in, they're often surprised by how much hearing aids can make a difference. Imagine feeling like you're part of the conversation again, engaged with the people around you. Imagine being able to hear in restaurants, enjoying celebrations like birthdays, anniversaries, staying connected at social events and church again. You know, when you're not hearing, it's so exhausting. You're subconsciously working hard to stay in the conversations. And at the end of the day, you wonder, why am I so tired? There's also long-term health benefits linked to wearing hearing aids, including improved relationships at home, improved social life, improved mood, and better brain health. In reality, we don't hear in our ears, we hear in our brain. The ears simply convert the sound signals into an electrical impulse that the brain can understand. The damage at the ear level creates a block to our brain. And in a study from Johns Hopkins University Medical Center, Dr. Frank Lim tracked 639 adults for nearly 12 years. They found that mild hearing loss doubled a person's dementia risk, moderate hearing loss tripled the risk, and people with severe hearing impairment were 5 times more likely to develop dementia. We know that in most cases, hearing loss is progressive, which means it gets worse as we age. You know, you only have 5 ways to exercise your brain, which is through your senses: touch, taste, sight, smell, and hearing, right? Each sense sends an electrical impulse to your brain. And when you lose one of those senses, the brain atrophies at that area. Early treatment keeps the auditory pathways to the brain working. You want to make sure you stay sharp. You want to keep those neural pathways to the brain firing. It turns out when it comes to brain health, just like your muscles, if you don't use it, you lose it. So whether your ears are ringing or you find yourself turning up the TV or saying what and asking people to repeat, these are all signs it's time to get a hearing test. Or if you're like my grandpa, who finally just stopped asking and resigned himself to being left out of the conversation. It's really about being able to engage with your spouse and your family and your friends again. It's about being able to hear your kids and grandkids. It's about hearing "I love you" and leading an active life. Now, I know there's bias against hearing aids. They're so big, they're going to make me look old, they whistle all the time. Hey, listen, I've heard them all. Oh, and they're expensive, right? These are just excuses people use to put it off, but everyone who gets the right hearing aid says it's the best thing they've ever done. No one who has ever tried hearing aids from our practice thought, wow, that was a mistake. That's just not something that happens here in our office. We have over 100 5-star Google reviews, and don't take my word for it, go check them out for yourself and see what others are saying.
I'm Gary Slee, live here in Boise, Idaho, third generation Idahoan.
Okay, and Julie?
I've been here since birth also, and I'm a long-time Boisean.
Oh, I really fought it, Matt. I started hunting birds when I was 12 years old, and I was around shotguns my whole life, and I never used any ear protection. So I probably sensed it was a long time coming that I was putting it off. Matter of fact, I'll be honest with you, I was so vain about admitting it that if you'll remember when I first came in, I only asked for one. I asked you to test both my ears, and I said, which is the worst one? And I said, I'll only take one in it. And I soon had to live with that, and then got over it pretty quick when I realized how important it was. Well, my friends kind of made fun of me as far as outside pressure. I mean, it was a standing joke, although I make a lot of fun of them too, so we kind of good-natured about it. But it was almost getting to be the point of like Mr. Magoo, the old cartoon. You guys are too young to hear about that, but I remember growing up how funny it was. Well, now I'm the subject of the Mr. Magoo cartoon, so that was kind of the, and then my family started to pick up, and quite frankly, Julie, she was really getting frustrated with me. She'd have to repeat herself a ton of times, turn the volume up on the TV. I could really sense her frustration.
I felt frustration because he couldn't hear well. But I think our daughter, one year, I was telling you earlier, she gave him your card for Christmas in his stocking or something, and said, Dad, I've already made you an appointment with Matt, and you're going to go get, because she noticed that he was starting to withdraw from family discussions and kind of go in the other room and that kind of thing. And so, yeah, the whole family was noticing it. The Mr. Magoo comment is really key because it wasn't just not hearing, it was hearing things wrong and getting the words wrong. And it was like, oh, and then he was embarrassed to wear hearing aids, and I kept arguing with him, people wear glasses. Besides, it's more embarrassing to not hear what people are saying and make these gaffes all the time. You're better off to wear the hearing aids.
Well, I do feel the same way. It's like if I don't have them in, I almost panic. I have to go back and make sure I've got them in, just because like when you get a telephone call or somebody's talking to you from a distance, this gives you that advantage now to listen, almost come back to normal. And Julie's right, it's not perfect for me, but it's the quality of my life is so much better. I can't even tell you how much it's improved.
Yeah.
So let's talk about price. As you know, a pair of hearing aids can cost between $3,000 and $7,000, and they last a minimum of 5 years. This means that when you spread the cost over a lifetime of the device, the least expensive pair is going to cost about $65 a month, and the most expensive pair is going to cost about $147 a month. That's only $2 to $5 per day to hear. Now, don't quote me, but the last I looked, a satellite TV or cell phone package sometimes costs more than that, and those go on forever, at least until you cancel your service. Now, when it comes to hearing aid stores and salespeople, on the expensive end, you're going to have the national companies and the franchises. These guys run a lot of advertising. Someone's got to pay for that. They're typically the most expensive, and most of that will go to pay for advertising, franchise fees, and sales commissions. On the cheap side, you've got the big box stores and the internet. They have to make it up somewhere, so they either sacrifice the quality of the electronics or they remove all the service and the care. In the middle, you've got private practice audiologists like us. We're a multi-line dealer, so we can choose among all the major hearing aid manufacturers. This ensures that we have the option to choose the right hearing aid specifically tailored to you. And we have different price ranges to suit every budget. You'll most likely get the best value because we don't run a lot of ads, and sorry, you won't be able to buy bulk food when you get your hearing tested with us. Here's what you need to do next. Click the link and schedule a hearing evaluation. It's absolutely free. We'll test your hearing, examine your ears, and tell you where you stand. We'll even show you the inside of your own ear canal with our high-tech video otoscope. We may find that it's just wax buildup and a 10-minute cleaning is all you need. Here's what you can expect when you come in. We start with an initial interview. We want to hear about your situation. We want to learn why you decided now's the time to check your hearing. This appointment is about you. We take a case history. The case history will get us into more details about your ears, any pain, surgeries, dizziness, etc. We'll ask about family history or noise exposure. This information can help determine the best treatment plan, but more importantly, if there's any underlying medical issues that need to be addressed prior to hearing aids. We'll complete a hearing evaluation, and this is where we learn about your hearing. You may have had a hearing test in school where they have you raise your hand when you hear the tone. We do that, but to much more detail. We'll test both the right and left ears and plot it on a chart called the audiogram. This gives us a picture of the damage at the ear level. Then we run a word recognition test. We set the sound to a very comfortable listening level and ask you to repeat words. This will help us determine the connection between the ears and the brain. Once we have all the results, we'll sit down and show you the audiogram, explain how it affects your daily situations. We recommend you bring a familiar voice, maybe your spouse or a family member. We'll need their voice to do part of the testing. As we discussed, we hear in our brain and not in our ears. Hearing loss typically occurs in the cochlea, which is the nerve center. The cochlea has about 30,000 hair cells or nerve endings in an area about the size of a dime. If you damage one area, you lose those tones. The more they get damaged, the greater the hearing loss. Unfortunately, there's no surgeries to fix the damaged hair cells, and they don't grow back. Once we determine you're a candidate, we'll program a set of our demonstration hearing aids for you. These devices will be set to your prescription using a specialized verification tool called live speech mapping. Now, live speech mapping is probably the most important aspect to fitting any hearing aid. If you've had a hearing aid before or know someone who has and the provider did not use live speech mapping, there's really no way to ensure that fitting is correct. The best part of today's hearing aid is that they're simple and complex. And what I mean by simple is they're simple for you to operate. As a matter of fact, if you find yourself messing with your hearing aid and making a lot of adjustments yourself, something's probably wrong. The best hearing aid is the one that makes you hear, but you don't notice. And over time, it becomes part of you. When I say complex, I'm talking about what's inside the hearing aid or what makes it tick. Most of the hearing aids today adjust automatically to your environment. If you're in noise, they adjust for noise. If you're in quiet, they adjust for quiet. Remember, these are tiny computers that are constantly processing information up to hundreds of millions of times per second. In addition to all this technology inside the hearing aid, we now have rechargeable hearing aids and the ability to connect to our phones and TVs. It's pretty cool. We'll tell you more about this when you come in and see us. So what can you expect? Well, it's going to take a little time for your brain to adjust. We tell people the first 3 days are the get used to it phase. Days 4 through 5, things will mellow out a little bit. This is your brain getting used to hearing again. Days 6 and 7 should have some periods where you forgot you even have them in. Maybe you reach up to feel for them. This is the sign that your brain is acclimating to the new sound, and it's becoming natural again. When you come back in after a week, you're either going to be a believer or you won't. The number one reason to come to a professional like us is because, unlike the big box stores or the national advertiser, our focus is on you and not a sales quota. Our reputation is on the line. In our office, we won't let you buy until you've tried them for a week in your own home and in your own environment at our expense. Some of the other providers may say free trial, but they want money up front, or they offer a refund later, or they let you try in the office only. If you don't find our trial pair of hearing aids life-changing, simply bring them back. There won't be any pressure to buy something you don't need. On the other hand, if you're interested in learning more, we'll help you get the best value for your budget. As I mentioned, with the least expensive pair being about $65 a month and the most maybe $147 a month, they're really more affordable than you might realize. You won't regret taking the next step. You have nothing to lose. We know you'll have a good experience and you'll know what better hearing is like. Hey, it just may improve every aspect of your life, but there's only one way to find out. Click the link below, schedule your free hearing exam today.
My name's Angie Tate, and I'm a local family physician, and I have decided to wear hearing aids. I was at that point where I was beginning to lose conversation and miss conversations, and I was really struggling in loud crowds as well, and in noisy places. I couldn't have conversations. And so Matt fit me with a pair of loaner hearing aids, and we were just talking in the exam room, and I realized at that moment that all of a sudden I didn't have the tinnitus. It was gone. And then I practiced with the turning them on and off, and I couldn't believe the difference that I felt. And it was almost like, you know, when you sigh, your body kind of sighs like you're just getting ready to sleep, and your body just kind of relaxes. That's what it felt like. Is like all of a sudden my body could just kind of go, okay, all right, I don't have to deal with that tinnitus anymore. It's just gone. Yeah, and it was really like that irritability that I felt was almost instantly relieved. And so I really realized when I don't have them on that I just struggle more. It's just life is just harder in general. Just everything seems a little bit harder. And when I have them on, things are easier. Like I can communicate better. I can hear better. I'm not dealing with the tinnitus all day long. I can hear the dishwasher beep. I can hear the refrigerator door beep if it's left open. So I can hear all sorts of things that I couldn't hear before.
Perfect.
I can hear the birds.
Perfect.
So it's an interesting experience from going from not wearing a hearing aid to wearing a hearing aid. And it's so instantaneous. It's almost like looking at a black and white photo and then looking at a color photo. It's awesome because all of a sudden the world is just bright. I didn't really realize how dull conversation was, because it was like everybody's muted. It's not bright. Life is not bright. It's very dull.
That's cool.
Yeah.
Yeah.
It's really awesome.
That's awesome. Look, you've got one shot to get this right, and too often I see people settle for the cheapest pair of hearing aids they can buy. I hear people say all hearing aids are the same. It's just not true. They end up buying 2 or 3 sets. I've even seen some people who have purchased 4 sets of cheap hearing aids based on price alone. And sure, when you put them in your ears, they're going to make sounds louder. But when you go to a noisy environment where you struggle the most, they make everything louder, including the noise, and you still can't hear the people around you. So they end up in the drawer. At the end of the day, they've spent more money than if they would have bought the right pair the first time. And it breaks my heart. Patients come in having wasted all their money on cheap hearing aids that weren't fit correctly, and I really don't want that to happen to you. I know we've covered a lot of ground, and hopefully you have a better understanding, but you should be asking yourself one question. What does it sound like? There's really only one way to find out. You won't regret taking the next step. The exam's free, the consult's free, our demo hearing aids, they're free. You have nothing to lose, and with us, there's no fee or obligation. The demo hearing aids will either improve your hearing or they won't. They're going to be affordable or they won't. It's as simple as that. Click the link below and schedule your free hearing exam today.
I'm Derek Grewatz. I mean, it's just incredible. You know, you want to go to the movie? No, I don't want to go to the movie. I can't hear. Why would I go to a movie? You want to go out? No, I can't hear in a restaurant. You know, I mean, so my whole life has just been opened up. Well, now I look forward to it. You know, because now instead of going through life with fingers in my, you know, I can't hear and understand anything, now I can. So, and I don't care that it's behind my ear. I'm past that because it was affecting relationships. It's affecting my work because I can't hear as well. Now I can pick up phone calls. And that's all I do. I have an office phone. I don't use it. I call people and ask people to call me back so I can get it in my ear. Yeah, nobody even sees it. Especially at first, I was self-conscious, so I would tell people, hey, do you see anything different? You know, and they said, if you wouldn't have said that, I wouldn't have seen anything, because you can't really see these, you know, and nobody sees the back, you know, unless they're standing behind me. But, you know, in conversation and meetings and so forth that I go to, nobody, and I don't care either. That's the beautiful part is, I don't care if nobody says anything anyway. Nobody ever has, but if they did, I don't care because I can hear now. It's incredible. Well, just so much more confidence because, you know, especially in a room where there's a lot of people, like a business function or go have a glass of wine, a meet and greet kind of thing, I just dreaded that. Because the background noise, I know I'm not going to hear anything. People, you know, I got to engage. And even though we're 2 feet away, there's 50 other people in the room, the background noise is drowning it out. And I can remember the last one that I went to, it was up in Sun Valley. And I couldn't hear a thing. And the whole time I was just, yeah. And I don't know what they were saying to me. And now I can go into that same meeting and just have a nice conversation. It really is something. It's one of those deals where now that I have a solution, I'm kicking myself that I didn't do it 15 years ago. I wasted that time and frustrated a lot of people, you know.